One thing I know for sure, there obviously needs to be guardrails around it, an emphasis on, compliance.
There's not enough professionals out there today to actually manage the entire provider company.
Hi, welcome to System Logic Podcast. I'm Jason Lee. Today we have a very special edition of our podcast with a roundtable. I'll be joined by a couple of titans in the industry, some folks, both friends of mine as well as experts in physician compensation. First of all, Jamaal Campbell, the GM of Provider Enablement at Hallmark Technology, who is leading the charge in automated healthcare information platforms. And later on today, we'll be joined by Jack Liu as well from Procare Portal. Jamaal, thanks so much for joining us.
And thanks for having me. So you all know Jason and I go way back. We grew up together in this industry. Pre-facial hair, as a matter.
That's right. That's right. So just for the audience, Jamaal, why don't you just give everybody a little flyover on your background and some highlights from your past career?
Absolutely. So I grew up in the management consulting industry. I was a partner at ECG Management Consultants, where I co-led our national compensation strategy practice and founded and led our compensation administration practice, but included some introductions into the world of technology as it relates to provider compensation.
Fantastic. And more recently, of course, you're taking on the role as GM. Tell us a little bit about that, and we're super excited to see you in that position.
Yeah, I am the GM of Provider Enablement for Hallmark Healthcare Solutions. In my role there, I have ownership of the P&L, and specifically related to operations, financial performance, and implementation of our solution.
Fantastic. And so, we're here today in Nashville, AAPCP conference. I think everybody is thinking about how medical groups are evolving, how providers are being incentivized. And of course, over the last 20 years, you and I both have been thinking about that very deeply. As you think about the recruitment arms race, right? You're thinking about medical groups bringing on new candidates, bringing on APPs, bringing on new physicians. How is the infrastructure that they're offering to the providers important to helping them make that decision?
I think it's very important. Even more recently, it's funny, I was on a call with a client, and she was actually expressing that specifically. She wanted to bring their technology partners and vendors to a national conference to really demonstrate, This is how we've deployed the technology. Here's how it will work for you. Obviously, you have to be someone very seasoned in having those technologies within your organization. You would have had to have worked through the kinks.
Right.
But they invested in technology very early across the board, and they're using that as a way to actually leverage and enable their recruitment.
Absolutely. And so what are some of the things that you often get? I mean, you and I both talk to a lot of medical group leaders, whether the finance leaders, whether the medical group leaders on the clinical side. What are some of the questions that you're getting these days? Because I can tell you, every physician I talk to is like, hey, I want some more data, some transparency, and B, how can I use AI to help me do the things that I need to do?
Those are the two most important ones, right? Mm-hmm. And I'll start with the former. How do you get data? Everyone's saying we need greater transparency, right? Mm-hmm. Can I trust the data? Physicians are asking, how do you extract it? Mm-hmm. Are you comparing it to historical ways we report? Mm-hmm. How do we know that even though you're able to give me those reports in real-time manner, that is actually accurate? Right?
Yeah.
And just walking through those workflows and processes. So I think how you set those things up on the front end becomes key. And no different than when you were out in the field, Jason. It's like bringing physicians and providers along at the beginning of the process.
Yeah.
Even when it comes to technology, they need to be involved and engaged. Mm-hmm. AI, the big question I get, whether we're talking about physicians or leaders, is everyone says they have AI. Do you really have AI? What is it? Because most of the time people come in, I've had vendors tell me they have AI, we deploy a solution.
Right.
It's a web-based solution. It's not even they don't have agents. They're not leveraging AI for anything. Mm-hmm. Just a glorified spreadsheet. We've gotten a lot of that.
Yes, totally. The glorified spreadsheet piece. And one of the things that I have been endeavoring to do, and I've been playing with a lot of AI tools out there, whether that's the Claudes or the OpenAIs or what have you. Have you gotten a chance to dig into some of those, and have you thought about how providers may or may not deploy some of those things more, productively?
I think those are very powerful systems. Cloud is very powerful. I've used ChatGPT a lot. I think we still have to be careful in how we leverage them, and even from a provider's standpoint, right? When you think about even as great as those, I want to call them tools, solutions, or things they could leverage, but I think we still have to be careful. But absolutely, I think as they get smarter,
Yeah.
I think more experience with understanding the questions and what matters, I think those will be leveraged.
So, a lot of our audience are sort of newer administrators in medical groups and even some grad students out there. As you think about some of the dangers that you're concerned about with AI, just what are a couple of those things that you think folks should be aware of? I mean, certainly there's ethical questions, there's data questions, security questions. Like, what are some of the things that you feel are the most important?
We get a lot of pushback when I'm having conversations on the security aspect of it. And frankly, there's a lot of organizations, I would say it's about 50-50 now, who went all in saying they wanted to deploy AI technology and now are taking a step back and saying, we don't really want to visit it right now. We may revisit it at a future date. So they want to make sure solutions don't even incorporate AI. Right. So security is a big concern. I think also just misinformation. I mean, whether you're in professional services or any other field, it's not intended to replace what you do on a day-to-day basis. It may give you 80% of what you need. But you still need to think. You still need to take that information and say, what truly is the story? How do I leverage this information? How do I push it forward? So it never takes you 100% of the way there. But I do think that is a risk because I've noticed when people are leveraging and they're using those systems, that critical thinking, that intellectual curiosity isn't what it is. Don't have that to leverage.
Yeah, I think I've come across that quite a bit as well. Whether it's high school students that are just sort of using AI to push out their articles or essays or what have you, or even all the way up to a physician who's had years and years of training, that AI can be too much of a crutch, too much of a support infrastructure that sort of de-skills folks and allows them not to engage their brain and not to help them think. And so one of the things that I've been talking with a lot of leaders about is how do we use it as a support, use it as a booster, but enhance an analytical power, analytical skill of the people that are using those, right? And, I think that a lot of times, especially in our field of provider medical group optimization, provider compensation, those areas where it's really hard to find people that are not just experienced, but skilled in that area. And so, I think that, AI can go a little bit too far in some of those instances, So, as you think about other tools that you've come across from a medical group standpoint, have you had many discussions with providers around certainly their productivity, their quality, their clinical experience, from whether it's open evidence, whether it's ambient speech recognition kind of platform? What are some of the things that you have found most intriguing, or some interesting use cases that you've come across in terms of the tools that are out there these days?
Absolutely. I don't have a ton of familiarity with those tools that are impacting their clinical flows, but certainly I've had conversations with providers about it, right? They're feeling an immense amount of pressure to also be more efficient. It's like, so it's not just in our roles and the typical business roles we see, but also clinicians are feeling that push to become more efficient. So they want to make sure they also have appropriate tools. But again, the fear is, and especially probably even more important for them, it can't replace the true problem solving. A clinician is truly a problem. Right? Just wants them to should be able to help them get to that point where they're actually focused on problem solving versus all the various types of documentations and everything else they're having to do up front.
One of the topics that often comes up as well is the administrative team. And I know you and I over the years have done many studies, research about, what's the right amount of infrastructure that needs to exist? What's the administrative ratio? Often you hear about revenue cycle, you often hear about nursing ratios, but you rarely hear about the administrative infrastructure and the administrative ratios for a medical group. Talk a little bit about what you have found over the years, or some of the research that you've done in the past, and how that is changing these days with the advent of some of the technologies that have come into play in the last few years.
Yeah, that's a great question. I think that many people, I think more and more are understanding that the provider compensation world is a very complex environment. There's no one size fits all. So you could go at one organization and you'd say, hey, they have 1,000 physicians, they may need X amount of people, so they say. Compensation teams may be structured in a way to support that. You can go to one that's half the size, but just given the nature of the workflow, the manual handoffs, the complexities of the plans, they actually may need more talent to actually support their program. I think that creates some challenges. So that's the other thing, is like, you can't even say, hey, here's an appropriate ratio from here versus there, because there's so much that goes into it, right? But those teams, when we think about the leveraging solution, I don't think it's an FTE replacement, because the reality is that most people can't find the talent complement they truly need. Right?
Yeah.
There's not enough professionals out there today to actually manage the entirety of provider compensation.
Right.
That's why there's significant backlogs and bottlenecks that exist. Never able to truly work forward.
Yeah. Right.
I think leveraging technology, what allows them to do is truly stabilize that work.
Okay.
Right. So maybe I don't need the additional 5 FTEs, because my team can actually appropriately leverage the solution.
I see.
And streamline the way we do work and approach work, including
Right, right. So you're able to achieve more with fewer folks, and those folks probably are even more efficient and more effective, I find, when they're able to use a platform like that. Right?
Absolutely. And even those environments, you're still having to hire the appropriate people, right? Because what you want to hire for is that intellectual curiosity.
Yeah.
You want to hire for someone who wants to be a problem solver.
You're right.
Because then it allows you to take your function from being just playing catch up all the time
Yeah.
to actually being forward thinking. How do we actually approach provider compensation?
So we mentioned a little bit also on the data piece, right, and the transparency of data and the need for organizations to have clean data, have the providers trust that data, and to some degree get access to that information. What are some of the challenges and ways in which you see that problem being addressed, and how does lack of information for providers hinder both your quality goals, your clinical goals, and your productivity goals?
I think to the first part of the question, it's just disparate sources of data.
Okay.
Right?
Okay.
Like most of the time, organizations have enterprise solutions for everything.
Yeah.
They're not necessarily built for the physician enterprise, provider enterprise, right?
Okay.
So the provider enterprise is really plugging into some of those and saying, how do we actually deal with reporting, extract the information, kind of fit into that box that's actually been designed for the broader enterprise, but not the provider enterprise. So I think that creates a lot of challenges in being able to extract, validate, and report on various data.
I see. So you're saying even though an organization might have the Epic, might have Workday, might have some other platforms that's not optimized for the provider experience and the provider data, and so you're still not going to be able to really inform your teams, your clinical teams, with the right information.
Absolutely. It's like if someone were to have a contract management software. It's like you can get that in a typical HRS platform, but it's for the broader enterprise, right? It checks all the boxes for almost every other position that exists, except until you read a provider contract and realize, like, this is a very new piece of paper, right?
Yeah.
So it's a different dynamic, and that's just one example of what I mean. So we're trying to fit something in a place that is not intended to.
Yeah. Well, and a lot of those contract management softwares, to use your example, they've got all these corner cases for procurement and for buying supplies and drugs and whatnot, but those are not physician contracts. There's those, some of the. I was talking to somebody the other day about the benefits offered and recruitment benefits offered, and somebody that was involved in the conversation was not in our world of provider compensation, and their eyes were just spinning in terms of all of the different things that we have to think about when we're talking about recruiting somebody, not even from another medical group, but from out of residency per se. And you've got, the tail coverage, and you've got loan forgiveness, and you've got moving bonuses, and you've got, guarantees, and you've got, 15 different ways they could get incentives, because they're also being offered a directorship, and they also cover call, and they also might cover extra urgent care shifts. I mean, there's all of these things that exist that if you weren't skilled in this, you would forget, you wouldn't think about it, to say nothing of some of the regulatory fair market value things that you and I have certainly done over the years.
Right. Right. So when you think about the ability to then get that information and make it appropriate for the business you're running, doesn't fit. Right? That makes it such a challenging interaction and process.
Yeah. So what are some of the interesting provider recruitment stories that you've come across over the years, or maybe more recently? Anything that the audience might find interesting?
Outside of the luminaries, which we know we just need to figure out how to pay them more. Right?
Of course,
what we always heard.
Yes.
But I do feel like the information data is important, because people will say, "Oh, a provider left due to compensation." I don't think they asked that second question, right? Is it because of the level of compensation, or the fact that they actually didn't understand how compensation is paid, the mechanics, and everything within that? because sometimes it's not just about, hey, I want to make 10% more compensation. But if they don't understand how to actually get to where they're going in the journey and how to actually perform better, I think it's that lack of transparency which impacts their engagement, their ability to actually operate top of license.
I love it. I love it. Fantastic. Well, Jamaal, it's been a great start so far. We're going to take a little break, and we're going to be joined by Jack Liu from Procare Portal, and we'll be right back after this message. Many folks are super familiar with you and Procare Portal, but for those that aren't, why don't you tell everybody a little bit about yourself and, your journey here as one of the pioneers?
Yeah, absolutely. So interestingly enough, I didn't start my career in provider compensation management.
Okay.
Yeah, I started it in sales performance management and sales compensation management in a couple of different vendors that came up in Silicon Valley. Early 2000s.
Okay.
Yeah. What's interesting about the physician or healthcare provider compensation management space is that I see a lot of similarities that mirror sales comp and sales performance management, 25 years ago. Here at the AAPCP, this is one of the things that I've seen, early days of sales comp when not everyone was really sure what this profession was all about. There was no real training curriculum certification or structure to legitimize that profession. Yeah. And you saw professional associations and organizations develop, such as the AAPCP, to legitimize and do credentialing and so forth. So it's great to see this industry grow over the years.
Yeah, absolutely. Actually, Jamaal and I were talking about that a little bit before you came on the show, about how the skill and the expertise within this segment is so unique that you couldn't even get somebody from down the hall from the hospital finance team or from RevCycle, even though they work in the same organization, same building, there's no way they could even, think to try to dive into some of the pieces that we have challenges with. So.
Yeah, I mean, that's exactly right. The challenges of this profession is that it is so pervasive, right? It's a mission critical function that has so many different touch points. Mm-hmm. It's not really localized to any one department. Right. And outwardly, when you go to, when I talk about the profession to other people that are not in the space, they're like, oh, you're in comp, that's HR, finance, accounting,
not exactly.
Payroll. Not exactly.
That's right. Well, so what are, we were talking a little bit earlier about some of the things that we're hearing out there on the road and some of the medical group leadership. What are some of the biggest challenges that you've come across lately, particularly in this age of rapidly changing technology, the introduction of AI? Are there certain elements that you hear most frequently when you're talking to key medical group leaders?
Yeah, absolutely. And I mean, you bring up a really interesting topic with AI, right? Mm-hmm. Like we're now in, I think what we're calling, the agentic era.
I think that's right.
Yeah. I mean, it's beyond just AI or, generative AI, right? Mm-hmm. Like text-based responses and whatnot. Mm-hmm. We're talking about agents replacing potentially human work. Potentially, yes. Yeah, which is a very dicey topic to talk about. But no, at the end of the day, the big topic, I think, on everybody's mind is how is this going to change the way healthcare does business, right? How is this going to change the way we provide care?
Yes. Well, and I think that's the question, right? Because, the folks that I talk to, certainly having been in other segments of the industry where value-based care is being impacted heavily by technology, where just pure clinical delivery is being, obviously, with all of the scribes, digital scribes and whatnot, and of course, the evolution and continued improvement of EHRs and using all of that data is just impacting how we deliver care every day, which is vastly different than the way it was 10, 20 years ago, and beyond. I on a previous episode, I had John Nelson on, and he spoke just lovingly about the industry of hospital medicine, and we were reflecting on some of the differences of how those providers access information. When you've got ED patients coming in and they're transferred up into the wards, and some of the information exchange was just so different than it was, when he first started in the 80s and 90s, of course. So, one of the things that we've been talking a little bit about before you got here was how that AI not only is impacting, but how folks are thinking about technology differently, with AI. And there are you see out there all kinds of posts on TikTok and on Instagram and whatnot of like, hey, single person $1 billion technology companies, let's just use AI to whip up something real fast, and you can turn that into a company. Why is that just not going to work in the world that we live in, fellas? Jamaal, what do you think?
You have to have true expertise in the space. Right?
Mm-hmm.
You still have to understand how things work, how things operate.
Yeah.
Even basic general workflows. If you don't understand that, speak the language, and
Mm-hmm.
understand where they even extract the information you need
Mm-hmm.
to actually develop a platform or solution, I don't see that working. That's also why now we see a hesitation of, I think, hospitals and health systems. When we were thinking about the pandemic era,
Yeah.
everybody was like, I need a solution technology. You can go, and they would try anything out. They put a pause on it.
Okay.
Because 90% of them didn't work.
Yeah.
They couldn't do what they thought or what it was expressed that they would be able to do. And
Yeah.
It's problematic.
Yeah.
And I want to hit a bit like when Jack was talking about agentic AI, it's like when you think about it, it could potentially replace you. We hope that, we try not to say that, because in general, what I hope is that it would kind of make things more efficient.
Mm-hmm.
But you talk to clients sometimes and you think of monthly close, for example.
Right.
And you run the physician enterprise and it's the largest expense line item is the clinician on the P&L,
Mm-hmm.
right? And so it influences a lot of that process. But you got some organizations where it could take them 10 to 15 days to close a month. Right? So imagine if your resources are spending that much time to close month end. Imagine the number of bottlenecks and backlogs that
Yeah.
again, are growing and growing and growing.
Absolutely.
It would be great when you can leverage the technology, and specifically even the agents, to actually help speed that up. So now I don't have 10 to 15 days.
Yeah.
Maybe it takes me 2 to 3.
Yep.
And now I'm back to business as usual and pushing things forward.
Right.
I think that helps us. Again, we talked a bit about the talent race earlier on. Kind of understand we may not need to fill all these positions that it takes us a year and a half, 2 years to actually fill one, right?
Yeah.
Because again, I feel we're at AAPCP, like Jack said, and it's like you look around, it's a bunch of unicorns, right? Everybody's here. It's hard to find this type of talent.
Yeah, for sure. Jack, what do you think? Can health systems? We hear health systems. Hey, let's just get a couple of our IT guys to whip something up in, with some of these vibe coding tools. What do you think?
Well, one thing I know for sure, there obviously needs to be guardrails around it and an emphasis on, compliance, right, and security. And really the way I think agentic systems work today, there are a lot of use cases to apply workflow automation, right? From the front end, but the key is, like Jamaal says, domain expertise.
Yeah.
How do the pieces all fit together, right? You're not really looking at it from, individual silo standpoint. That's not going to move the needle at all.
Yeah.
Right? It all has to tie in together, all of the, financial, clinical indicators all have to inform each other, right? We talk about having high fidelity data, and that's important because that allows you to get to a granularity. And you mentioned value-based, entities. I mean, at the end of the day, this is how we're going to inform, clinical systems and pathways of what is the optimal moves, right?
Right.
Yeah.
What are some of the biggest questions that you get, Jack, around data transparency, data availability? What are the things that you're sharing with organizations today, and what are the things that you get asked about a lot?
Yeah, I think now with the critical mass of data that a lot of us have, the question is, what do you do with that, right?
Yeah.
How do you operationalize that data?
Yeah.
And I think really from a high level perspective, we have to be able to longitudinally look at that data across different quadrants. You know, we talked about financial, clinical, compensation, even cultural. Yeah, to then inform the systems of where the problem lies. It becomes a shift.
Yeah.
You know, I believe where currently it's still very reactive, right, to more predictive analytics.
Okay. And what are some of the cool things that you're hoping to see in the next, I don't know, 12 to 24 months and things that you think medical groups will really find valuable coming in the next year or two?
Well, you know, in the world of AI, I think there's a lot of potential, right? I think a lot of workflow automation, you know, as Jamaal alluded to, you know, how we intake patients, right? Scheduling, triage, routing, all of those things I think we'll see AI have a direct impact in.
And continue to refine some of those processes. And I think informing the EHR piece will then allow us, particularly within our little corner of the industry, when we're trying to determine the both productivity as well as quality of the providers, how does access get changed? How does productivity get changed? And ultimately, how do we incentivize providers differently? How much do you guys view the use of technology as critical to developing provider incentives, right? I don't know if you guys have a strong opinion about that. I've often thought about that myself. So
if you think about improvement of access, it's always a metric when you think about incentives. We want to increase productivity, even though we want to get into this value-based world. You know, fee-for-service is still king in human payment mechanics. Any other measure you think about, like if you think about overall efficiency, and again, having the information so providers understand how to adjust behaviors is necessary. Whether we're talking about provision of clinical care or otherwise, how do I actually get patients in a more efficient manner? I think technology is extremely key to that. I mean, you talk to most providers, they spend a ton of the day in paperwork, right? So again, there's a lot of, I think, systems that exist today, but it's still very disparate. It's still not coordinated. And you still see a lot of pain points they have that they talk about all the time is that it's very difficult for them to see one patient, process one patient. So the ability to actually streamline that overall workflow and even leveraging the agents to potentially, I hate to call it shortcutting, but shortcutting the process a bit, making things more efficient, actually get to that point, I think makes a huge difference.
Yeah, for sure. And as you guys think about, like I said, again, the next couple of years, what do you predict will happen with some of the policy changes? Do you have any perspective on how reimbursement might get changed or might have some impacts? Certainly, we've got a CMS and an HHS that is emphasizing certain elements of reimbursement and not others. And so just curious how you guys have thought about that in your organizations and whether or not that will impact what we do from a provider incentive standpoint at all.
Well, I think if you look at the data, right, if you can hone in on utilization and look at contribution, you know, by payer group or by, you know, patient cohort, I think that will allow us to optimize, you know, payer incentives a little bit more. Right? And then, you know, we got into this business always with the big pie in the sky with value-based care. I know early on in your career, Jason, as well, and you know that is still something that I believe would really move the needle, right?
I think so. Jamaal, what do you think?
And the data is there. You know, we just haven't figured out as a sophisticated country that we are, how do we bring all the data from all these places? Because all the information is available. We can drive all aspects of the industry beyond just thinking about provider incentives and assuming we actually change that and how pay is actually determined for providers, payer environment, and all of the above, even how consumers access care. We don't have any of that, but the data is there, but we've yet to connect the dots.
Absolutely.
To tell the story.
Yeah, absolutely. Well, gentlemen, what else is on tap for the AAPCP for both of you? I know it's a great conference and a lot of great folks are here. Anything fun and exciting over the next several days for you?
It's just great to be here. I remember early on in the conference, like I wasn't at the first one. Certainly was part of some ancillary conversation. There's been quite a few since then.
Yeah.
Man, this has grown a lot. Like
Yeah.
I remember walking into the auditorium this morning, I was like, this truly is like our Super Bowl.
Yeah.
Right? And so for me, I'm just excited to see a lot of faces, familiar faces. But the first thing Alex asked at the beginning is, how many people is this your first conference? I say at least 30% of the room hadn't been here before.
That's great.
So this is steadily growing.
Yeah.
Right. So you think about this is huge. Next year will probably be even bigger. So
Absolutely.
I'm just excited to meet new faces, understand the different pain points folks have, and
Yeah.
even pick their brains about what do you think the market is going, right?
That's right.
And specifically understanding each organization's individual pressure points because they differ slightly.
Yeah. Jack, would you recommend new and up-and-coming medical group leaders come to this conference? And
absolutely. 100%.
Yeah.
Yeah, no, I'm really just jazzed about how it's grown, and really, we all come here, I think, with the same objective of really uplifting this entire space.
Absolutely. Yeah. That's very well said. Very well said. Well, gentlemen, thank you so much for joining me today. Jamaal, Jack, great conversation, and hope you have a great rest of the conference.
Thanks, Jason. Thanks for having us.
Well, that's our show for today, System Logic podcast. We were joined by Jamaal Campbell and Jack Liu, two leaders of the physician-provider compensation technology space. If you want to hear more conversations like today's, please like and subscribe System Logic podcast on YouTube, Apple, and Spotify. We'll see you next time.